Hello, dear friends. My name is Sofya Dorinskaya. I am a doctor, head of the Center for Medical Information and the School of Vitagnostics. Today, I would like to talk to you about pancreatic cancer prevention. The fact is that due to the epidemic that is currently developing, everything is still going on. In some countries, we know that people with pancreatic disorders are the most vulnerable. So for those who have been ill, have recovered, or have this condition, I think this video will be very useful for you. So pancreatic cancer develops from the epithelial glandular tissue or the ducts of the gland. The key word here is epithelial. The ducts are also lined with epithelial cells. What is cancer? What is oncology? It is the uncontrolled proliferation of epithelial cells, which then leads to further growth and the destruction of other tissues through metastases. Basically, conceptually, I think everyone now understands what oncology is, what cancer is. And this question, where does the fear of oncology come from? What should be done? Is it some kind of divine punishment? Still hangs over people. And that entry point, that clear explanation of what it is and how to deal with it, is still not being clearly articulated. So even now, there is still confusion and uncertainty about what to do. We just don't know. Meanwhile, statistics show that pancreatic cancer develops very slowly. Before the first symptoms appear, it takes almost 11 years. Almost 12 years pass. Then another nearly 7 years go by as it continues to develop, and only after that does it reach the terminal stage. So that's almost 20 years. It drags on, yes, so it's quite a long-lasting disease. This leads us to think that, most likely, the cause could be a vitamin deficiency. Because vitamin deficiencies are very prolonged conditions that can stretch out over decades. And vitamin deficiencies can be fatal. But this fatal outcome, it has a certain progression, you see? There are specific diseases that are known to develop directly from a deficiency in one vitamin or another, you see? And let's recall here this book, Vitamin Deficiencies and Hypovitaminoses, and the publication by Professor Lepsky, two professors, Lepsky and Lepskaya, Rebecca Israilovna Lepskaya. They give us, on page 63 of their work, they present the following clinical case. So, a 25-year-old woman developed acute colitis in the summer of 1939, for which she was admitted to one of the hospitals in Kazan. 4 months after the onset of the illness, she was transferred to a therapeutic clinic due to persistent diarrhea. As it turned out, the patient had been on a so-called gentle diet the entire time, consisting of rusks, mucilaginous soups, kissel and semolina and rice porridge. Very rarely a small amount of pureed meat was added. The patient was extremely emaciated, with mild pigmentation spread across her skin. No changes in the internal organs that could explain the emaciation apart from intestinal disorders were found. Improved nutrition and the regular addition of liver to her diet brought some improvement, but the patient's condition was apparently already irreversible, and she soon died. It is very important to note that the autopsy revealed no other cause of death except for emaciation. No ulcerative processes were found in the intestines. Only significant regeneration of the epithelium was noted. Proliferation? The pathologist confirmed the diagnosis of pellagra avitaminosis. So why am I reading this out loud? This is an extremely important clinical case. There are no signs, no diseases present, and the only thing observed is the proliferation of epithelial tissue. Do you understand? Here, the progression was very rapid, just 4 months. Therefore, the woman was young, her organs were healthy, and yet they discovered this proliferation of epithelial tissue. And now just imagine if the clinical course lasts for 20 years, if the disease develops over years, even decades, then of course this data showing that pellagra leads to the proliferation of epithelial tissue, at some point, that's it. A collapse begins. The tissue grows completely uncontrollably because there is a vitamin deficiency. After all, nicotinic acid is involved in a huge number of processes. Therefore, in this case, the cause of pancreatic cancer is most likely pellagra. In the previous video we talked, in the video where we discussed the side effects of the coronavirus, we examined taste distortions. And there I showed that this is most likely a developing deficiency of nicotinic acid. And here too we have a deficiency of nicotinic acid, so we see a clear pattern emerging. Therefore, in all pancreatic pathologies, doctors must include nicotinic acid in treatment programs. Also, as you probably heard here, they gave this woman liver. Why? Because liver is highly recommended for people with a nicotinic acid deficiency. That's why animal liver should, of course, be a mandatory part of your diet. Any kind of liver is suitable, whether it's poultry, chicken, pork, beef, or lamb. Yes, especially as the Lepsky people say. About lamb liver, I think yes, as far as I remember. That's it. So we are building a sequence here. And it's very interesting that oncology develops from epithelial tissue. Here is the criterion. Our epithelial tissue begins to grow uncontrollably, so to speak. It proliferates when there is a deficiency of nicotinic acid. Therefore, nicotinic acid should be included in all treatment regimens for such people. If, again, the situation is quite complicated and the person is taking a lot of medications that are necessary, and there are questions about how all this interacts with vitamins, how to apply this specifically to your case, then please write from the website dorinskaya.com, or there is a direct email srdorinskaya@gmail.com. Contact directly, and you will need to go through the deficiency elimination program, because it is precisely there that you can properly combine the medications prescribed by your doctor, which of course no one is canceling, with vitamins, with recommendations. There, this combination is done correctly, and your doctor should be informed. We even write letters for you to take to your doctor, yes, so that he can read them. In other words, there is already focused work being done with each individual person. I hope my information was very useful to you, and I would be happy to see you with us. Stay healthy, subscribe to the channel, and become sponsors. All the best. Goodbye.